Hello and welcome back to my channel. If you're new here, I'm Tasneem Abrahams. I'm the founder of the Private Practice Growth Club, and on this channel, we talk all about how to start and grow a profitable private practice in South Africa. And as you know, I love featuring dynamic, innovative private practitioners and health professionals who are doing amazing things in South Africa. And so I'm so happy to welcome my guest today, which is Dr. Carolyn Chinsinga, who is a GP by profession, but she is currently the medical director of operations at a company called Quro Medical. And I'm so excited to share some of the work that Quro Medical does, how it can benefit you as a private health practitioner, but also really excited to share this amazing partnership that they currently have with Operation Healing Hands. So welcome, Dr. Carolyn, and thank you so much for joining me.
Thank you so much for having me, Tasneem. It's a pleasure.
You are actually my first GP that I have on my channel, so that's very exciting.
Look at that. Look at that. Well, it's an absolute pleasure then and an honor to be the first, and I hope I will do the GPs out there justice.
I'm sure you will. But let's start with that. How did you become a GP? How did you become a doctor, first of all? Did you always want to go into medicine?
Well, my mother will tell you that at some point I wanted to be a bus conductor because I saw all these double-decker buses in London with a conductor collecting money. And then at some point, a fireman. But I spent a lot of time in hospital as a child for various illnesses. And seeing the care that I got, seeing how they worked, it was just so fascinating. And the older I became, it became clearer that I wanted to become a doctor. So I studied at and at the University of Pretoria. And when I graduated, did the usual internship, ComServe. And then I started working in private practice and have a history of about 10 years in private practice, in trauma units, in casualty units, where all the action is. Yeah, but after some time, anybody who has worked in trauma will tell you that it becomes tiring, especially when you become a mother and you realize that your long shifts, you're constantly being away or constantly being tired, doesn't work for the kids anymore. But then I said, okay, you know what? Let's go into something different, and that's when the thoughts of starting my own practice started.
Yeah, and I mean, I think even if you are a health professional, if you've never worked in trauma or casualty, you have no clue of what it's like. You can only imagine. So, I mean, I've never worked in that kind of setting. I've worked in hospitals, but always in the later part after the trauma and casualties finish, and now we're in the rehab stage. So I can't even fathom. All we have, those of us who haven't been in that space, all we can reference is what we see on TV, like on Chicago Med and like ER and like all of these programs, which I'm sure all our professionals watch them, and that's part of what influenced our choices. So I can only imagine. Tell us a little bit about how that being in that environment as a mother influenced how did that influence?
So Tasneem, working in casualty, you see a lot of things. You come up with your heart attacks, your trauma, and it sticks with you for a long time, especially if it's a bad day. Even worse when it's children involved and you do the best that you can, right? And we've always found a way of debriefing, of working through it and knowing that we've followed all the protocols, everything is fine, we did what we could. And that's usually your solace to say, okay, there was nothing more I could have done for this patient. And then along came COVID and the dynamic changed completely, because to be honest, right in the beginning, nobody knew what was happening with COVID, when and how do we treat, what is right, what is wrong, and you try everything that you know medically, and still the outcomes were not great. They were not great, especially during that Delta variant. So it was very frustrating. But I think the biggest part that most people don't speak about are the patients who had preventable illnesses or treatable illnesses that were too scared to come to hospital because they were scared of contracting COVID. And you would find patients that have had a stroke 2-3 days ago that you could have fully reversed if had been there in time, coming in when they're almost at death's door. You have asthmatics that are coming in dead because they were too scared to come to the hospital. And for me, that triggered something in me that said, this is not right. You're putting in all this effort, and which you're losing both ways. So towards the end of the second wave, I'd just given birth to my second child, and that affected him as well because I never spent as much time as I wanted with him. Most of my colleagues were getting sick, and so instead of having your 4 months maternity leave, 2 months later I was back in the front line. But in
Wow.
the back
Sure.
of your head, you're constantly thinking to say, what if I come home with COVID? What if I die? What if my
Absolutely.
husband, who's also a doctor, was also in the front line? What if? So there were just too many what ifs. And then I had to say, what can I do with the knowledge that I have? And that's when I started to start my own private practice with a little bit of a different twist, and which was, let's see if we can go back to the old way of doing things and do home visits, because everybody was just too scared to come to either a GP or a hospital or a casualty unit. So let's find people at their point of need and see how we go about it. That's basically how my journey started in private practice on my own, without that backing of I'm employed, I have an employer. Now you're
Yeah.
standing on your own, and you're doing something different, and you're crazy enough to start it in the middle of COVID.
Yes. And actually, there were so many people that started businesses in COVID. And in fact, I know of quite a few in my community, the Private Practice Growth Club community, of people who started their practices either just before, so they were, didn't know, and maybe they wouldn't have had they known, or those that started during COVID. So that's amazing to hear. But I'd like to know, so then when you made that move to, that's a classic example of what you had done was identified a need and a gap in this industry. And so you started your practice to fill that need, as opposed to starting a practice and then not knowing what it is what is your differentiator. So tell me a bit about that journey then. When you did first start your practice, what were some of the, the challenges that you faced? And what was the big sort of winning factor or formula to make that a success?
So in the beginning, I won't lie, it was daunting, because you start your practice, you put the name out there, you put the word out there, you start your Google Ads campaign to get your practice growing. But there were not that many patients coming through the door that would pay off your overheads, so your rentals, and forget about making a profit. And that's something I think most of us don't think about when we go into private practice. You have to know that in the first 6 months or so, you shouldn't expect a salary from there. You should have something to fall back on. So the idea of doing something different, that was where it was coming from. The challenge that I faced was, yes, you'd get into people's homes, and it was fulfilling. It was beautiful. It was lovely to see the relief, and to say, oh, finally somebody's coming here to see me, to treat me, and I don't have to put myself at risk. But then now you have to bill for your home visit. How do you do that? How do you then also make sure that when you leave that home at 9 in the morning, at 3 in the afternoon, the patient hasn't deteriorated or has a false sense of security? Say, doctor saw me at 9, and yet there's something happening in the background that you're not aware of. So you'd have this, being the doctors that we are, you'd go back and say, okay, let me have a look again. This time I won't charge you. I just want to reassure myself before the day ends that you're still okay. So at the end, it was not making financial sense. Luckily for me, whilst I was in that space, then I came across Quro Medical. And what they offered solved for all of that, in the sense that I now had a company that is doing something totally different, running a hospital home service. And what they do is, you identify the patient, you make the diagnosis, and this is the care plan that I'd like to give for my patient. And then the team that they have comes in, puts in a biosensor on the chest, and now I have minute-by-minute vitals coming through to me. I also have the backing of a 24-hour center that is watching my patient, and if there's something worrying, they'll give me a call and say, Dr. Carol, please open your app on your phone, have a look. There's something happening with patient X. And then I can have a look and say, okay, no. Based on what we're seeing now, why don't we try this intervention or that intervention? And that made life so much easier for me. And then on top of that, the medical aid reimbursed me. So
Wow, that's amazing.
I didn't have to physically go in and see the patient every day. I had a team going on my behalf. They're giving the treatment that I need. And if I'm popping in, it's literally to pop in and say, hi, I haven't forgotten you. How are you doing? Oh, are you able to sit up and have a cup of tea? And then I saw beautiful outcomes with my patients as well, being treated at home. They got better quicker because they have the support of friends and family, egging them on. My COVID patients, when it comes to the physiotherapy, and the physiotherapist comes to your home and your son is saying, come on, mommy, you can do it. Don't be a sissy.
Yeah,
they did so much better. They did so much better. So that changed the game for me because I was able to treat a lot more patients on a daily basis, get reimbursed for it, and I was able to afford my overheads and actually make a profit before the 6 months was up. And for me, it was like, okay, there is a way around this.
It just sounds like everybody is winning on all fronts because you get to, be in constant contact with your patient without putting yourself out and having to sacrifice your own financial and mental well-being, because you don't have to worry all the time. The patient benefits probably the most because they have the benefit of receiving care in their most comfortable environment around their loved ones. They don't have to travel out to a hospital. And it probably costs them less as well in terms of the medical savings because they don't have to pay hospital rates. I would say that the hospital also benefits because now they only have the most essential people come into hospital. So they don't have to struggle with beds and capacity. And so they can manage their staff cost a lot better and, their overheads a lot better. So even they would benefit from people not coming into hospital. The medical aids definitely benefit because obviously it costs them a lot less to pay you as a doctor managing a patient from home than to pay in hospital rates. So it really sounds like it's an all-round win. I've never heard of Quro Medical before. So are they new? When did they start? What happened?
So Quro Medical came into existence in 2018, but only started trading as an entity beginning of 2020. And so right at the beginning of that COVID wave and COVID peak, and sort of accelerated their growth as well. In the sense that now everything that thought of and dreamt of, because the hospital at home model is an international model used in the UK, in Australia, and the US, to such a point that in the UK and in Australia, the government reimburses for it. So that is available to all government patients. And it's like you said, it's a viable model. It is a cheaper model because 70% of your hospital bill goes towards that brick and mortar costs and your overhead costs. And only 30% of that goes towards your treatment. So now if you're in your own bed, in your own house, with your own food, you're literally paying for that 30% of the treatment. And I think that's what made it attractive to me, because I had patients from the most affluent of neighborhoods to the most underprivileged of neighborhoods. So long as you're on some sort of medical aid or scheme, they will reimburse for it. And you're not paying a cent because it comes out of your risk benefit and not even out of your savings. So it doesn't do savings, it doesn't do anything. And during COVID, a lot of people had no money, or they had to downgrade their medical aids. And so it made sense. It made sense to say, here's an opportunity to treat patients in the comfort of their own home, give them the same quality of care that you would in a general ward in a hospital, and they don't have to pay a cent for it. If they don't have 2 cents to rub together, it's okay. You can still do it.
So it really sounds that the patient really is the biggest winner here. And I mean, I can identify with, being a mom late at night, you went to the ER because your child is whatever, throwing up on both ends, and they send you home and say, like, there's nothing really you can do but monitor the child, right? But it's like, you can't phone the doctor like every 5 minutes. So even aside from the financial impact, the comfort impact, I think just even as a patient or a family member of a patient, the psychological or emotional benefit of having the service must be so immense. But I'm also just thinking, because when you said that, that patients don't want to come in because they're scared, and then you go in, but now you have to go back because you're worried. I was also at that moment thinking, but like that is obviously in a unique situation of COVID, but actually for the majority of South Africans who live in areas where they don't even have access to go to a hospital, or don't have access necessarily to a GP, or they don't have the funds, or they live in rural areas and things like that. And then you mentioned this Quro Health, and I'm thinking even just having Quro Health made accessible even to like rural areas can be such a game changer for the health landscape of this country.
Absolutely. And that's exactly where we're headed. So, which brings us to, how we started slowly entering into that space. So when I joined Quro as the medical director, because, I enjoyed the work. I saw it's making an impact. And we basically decided, okay, let's do this. Let's join Quro officially as a company alongside my private practice. I then thought of ways of how do we then make this accessible to everybody else. And I remembered some fabulous work that a group of doctors were doing in the casualty that I was working. So there was an orthopedic surgeon called Dr. Helena Basson with her team of doctors, and they had an NGO called Operation Healing Hands. And basically their aim was, let's try and give some of the private care that we have access to patients that are in government waiting for surgeries for extended periods of time. So in the team, they had orthopedic surgeons, plastic surgeons, gynecologists. And what they literally do is approach major hospitals and ask and say, okay, who has been waiting the longest for an elective procedure or for a semi-elective procedure, and then pull them out of the system and sort of have weekends or 4 days in a row where they run operations back to back. All the care that is given is done for free. So the surgeons don't charge a cent. The anesthetists don't charge a cent. The nurses that work with them, the physiotherapists that do the rehab after the surgeries don't charge anything. And the only charge is just a basic fee, a minimum fee for the hospital stay, just to cover the overhead cost. And the hospital was also generous in that. But then obviously they would have to limit to say, okay, given, for example, a 250,000 grant, you can only service, say, 10 patients in a hospital stay. However, when we partnered with them and were able to take some of the patients on day 1 or 2 post-surgery home and give them that hospital care at home for free, then it allowed for, instead of 10 patients, 20 patients to be assisted. And I think that for me is a game changer. It is phenomenal.
Amazing.
And, like you said, it's small scale, but imagine what would happen if we could do it on a bigger scale, which is what we're working towards.
Absolutely. That's amazing. So, I mean, I've never heard of Quro Health, but I've also never heard of Operation Healing Hands. So, first of all, I'd like to know if there are other health professionals, GPs, can physios and other health professionals like speech therapists, OTs also benefit from using the Quro Medical? Because obviously you're speaking a lot from the vital signs point of view. What other features does the technology have that can benefit the allied professionals?
Absolutely. So remember, it's a holistic point of care, and you're bringing everybody together. So, for example, if you have a patient that has a pneumonia and they need IV antibiotics, the monitoring is one side. We can see what your SATs are, what your vitals are, all the things that sort of would trigger an alarm to say something is happening. However, there is somebody coming to give you your IV medication at home. The physio will come in and do your physiotherapy at home. And if we identify other needs, for example, there are lots of patients that struggle with mental health and they've been struggling with it for quite some time, and they're afraid to talk to their GPs or to talk to us in that 15-minute consultation about how they're literally not coping. But then when you've interacted with them in the comfort of their home, they tend to open up about certain things. Then we get our psychologists and psychiatrists involved and find a way of get them to connect with them virtually with the advent of telemedicine and start getting some of their treatment in. So it is literally based on the patient's needs and patient's care. And what we usually ask our allied health workers to do is just go onto the website, which is quromedical.co.za, and then register and say, I am a allied healthcare worker, put in your details, and we usually get into contact with you and see how we can partner with you in the different areas that you are in, and then take it from there. So definitely there's a benefit there. And they also get paid from the patient's hospital benefit as well.
Oh, wow. That's amazing. And you know what? As an occupational therapist, this really speaks to my heart, because as OTs, we are very much about context, because we are all about the functioning of the person. And really occupation-based therapy is, you get activities-based where it's, simulated activities, which is what a lot of our rehab currently is. When we are doing rehab in a hospital setting, teaching transfers and all of that, it's very much simulated to what they're going to do at home. But the true occupational therapy in the physical rehab space actually should happen in context, right?
Absolutely.
Because I always tell the story about when I worked for Western Cape Rehab Center, and I was doing rehab with a spinal cord injury patient who was a really a very big lady, and she had just standard standard wheelchair. And then we did the home visit only at the end when she was ready to discharge. We did all the transfer training, all of that, and we came to a house, and basically her wheelchair could just go into the door of a shack, and there was no space at all. So what was the point of doing all this transfer training? It doesn't apply. So this idea that you can have a patient go home as quickly as possible, be around the people that care about them, and you can, as an OT, not only train the patient, but actually train the family, the caregivers,
absolutely,
all these other things, like how much more better would the other treatment outcomes for the patient, not only from a medical point of view, but also from a functional outcomes and quality of life point of view. It's amazing. It's really amazing.
And you're 100% right. Sometimes it's very overwhelming, especially with a big life-changing diagnosis. As healthcare professionals, we will talk, and this is why you're doing. And half the time, the person is not 100% there because they're still dealing with that initial diagnosis to say, this is what my life is going to be going forward. So when you, like you said, when you have the family there, it makes life so much easier. Yeah.
So now you spoke about how the Quro Medical is really a big game changer, and how, it's really end-to-end total package care. And then you mentioned Healing Hands, and like I said, I haven't heard of them before. So if there are health professionals out there who want to get involved, because so many health professionals, and I think they struggle with the making money part because they want to also help people. And I think it's also an unhealthy mindset thing that we always say things like, oh, you didn't become a teacher to become rich, or you didn't become an OT to become rich. We need to stop saying that, because that might not be what you got out of the purpose. Your purpose for being an OT isn't to be wealthy. That doesn't mean that you can't want to become wealthy, right? Absolutely. And being involved in a organization like Healing Hands, where you can give back pro bono of your time, means it kind of takes away some of that guilt, where in your practice you can focus on being profitable, because you know that you're countering that with giving back of your time. So how would people, if they listen to this and they want to get involved with Operation Healing Hands in any way, whether it's by donations or kind, how would they go about doing that?
Okay, so there are two ways of doing it. You can contact us at info@Quro Medical, so QURO medical.co.za, and then we'll put you in touch with the team at Operation Healing Hands. Otherwise, they've got a very beautiful website called operationhealinghands.co.za, and you can just have a look there, and there's a button where you can click to either donate or click to actually be involved in the projects that they're currently running. And the nice thing is it's planned 3 to 4 months in advance, so you can plan your time as well as to, okay, I'm going to dedicate this particular weekend to being a part of the program in whichever way I can. And then you've got your way. And I think that the irony is that you need to be a successful practitioner to be able to give back that pro bono time.
Absolutely.
The more successful you are, the more you can give back. And I think that's something we've also learned at Quro Medical. The bigger the company is growing, the more we can do for other communities out there that don't necessarily have the same privileges that we do. So yes, please go out there, be successful, gun for it, become wealthy, because that's the only way we can try and start balancing out the indifferences that are there in society.
Yeah, absolutely. It's that whole thing of filling your own cup, putting your own mask on before you put others, that whole thing, cliche that we always hear, but we just never actually apply to our lives. That's what it means in practical terms, right? To make sure that you are taken care of so that you can be sustainable in caring for others. And that's just amazing. So are there any big plans or anything more you want to share about like the future for Quro Medical and Operation Healing Hands?
There is a lot coming through. I think the idea this year has been to grow the number of sponsors involved in the Operation Healing Hands projects. That is from even the manufacturer's point of view, give us free prosthesis for patients, knee replacements, hip replacements, and then plan big drives more often, because initially when Operation Healing Hands started 5 years ago, it was just a Mandela Day initiative. And now you have 2, 3, sometimes 4 weekends in a year, depending on the funding and the sponsorship and the time that practitioners give, that we allocate to that. But the big idea is in the next 2 years, have it as an ongoing entity. We know the challenges that we have in our public healthcare system, and we can sit there and say healthcare is failing. But in our case, it has to be healthcare is changing, and I'm a part of that change. Make it a daily thing to say we can be able to pull a lot more people out of the public sector and help relieve the pressure with our colleagues in the public sector and be able to then partner with the private sector. And I think it's a big game changer for me. That is where we're headed.
That is where we're headed. I love that message. I want to repeat it. Instead of thinking our healthcare is failing, let's think our healthcare is changing, and how can I become part of the solution instead of just complaining about the problems. That is so beautiful. And so thank you so much for that. Dr. Caroline, it was such a pleasure to talk to you. Of course, I'm going to put all the links to everything you mentioned in the description box below the video, so people can go and click on everything, and I encourage you to do. I'm so excited to see, what's going to happen with Quro Medical and Operation Healing Hands. I'd love to maybe down the line, if there's an opportunity to also maybe speak to Dr. Helen Basson about Operation Healing Hands and just go, some stories. I'd love to hear some success stories or some of the tear-jerking stories that makes us feel,
A nice thing is when you walk into Dr. Basson's office, her wall is just like mine behind, filled with pictures, but her pictures are all the patients that they've helped with Operation Healing Hands. And even though there are hundreds of photos, she remembers every single patient one. And that's what amazing. Their story is, and the stories are beautiful. So yes,
it's remarkable. I'd love to have her on. Well, thank you so much for your time, and I'll let you know when the interview is up. Thank you.
Excellent. His name.